Today, we're diving into a topic that many of you have asked about, the cervical stitch, also known as a cervical cerclage. It sounds a bit technical, but we're going to break it down in a really simple, clear way. So, what is it, and why might someone need one during pregnancy? A cervical stitch is a procedure where a strong stitch is placed around the cervix, which is the lower part of the uterus that opens into the vagina. Think of it like a drawstring on a bag, gently holding it closed. The main goal is to help keep the cervix closed during pregnancy, providing extra support to the uterus and the growing baby inside. So, who is this procedure for? It's typically recommended for individuals who have what's called an incompetent cervix or cervical insufficiency. This means the cervix might start to shorten and open too early in the pregnancy, without any contractions or labor pains. This can increase the risk of preterm birth or pregnancy loss. Doctors might also suggest a cerclage if someone has a history of second trimester losses, or if their cervix is found to be unusually short on an ultrasound. Now let's talk about the procedure itself. It's usually done between weeks 12 and 14 of pregnancy, though sometimes it can be done later if needed. It's a surgical procedure, often performed under regional or general anesthesia, so you won't feel any pain. The doctor places the stitch, and most people can go home the same day or the next. Afterward, you might be advised to take it easy for a few days, avoiding strenuous activity. Your doctor will give you specific instructions based on your situation. As the pregnancy progresses, your healthcare team will monitor you closely. When it's time for the baby to arrive, usually around 36 to 37 weeks, the stitch is removed in a simple procedure at the doctor's office, without the need for anesthesia. This allows the cervix to open naturally for labor and delivery. For those having a planned C-section, the stitch might be removed right before the surgery. It's really important to remember that while a cervical stitch can be a fantastic tool to help carry a pregnancy to term, it's a decision made carefully between you and your healthcare provider. They'll weigh all the benefits and potential risks to figure out the best plan for you and your baby. If you have any concerns about your cervix or your pregnancy, always have an open conversation with your doctor. They are there to support you. I hope this explanation was helpful and demystified the cervical stitch a little bit. If you found this video useful, please give it a thumbs up and subscribe for more content. Thanks so much for watching, and we'll see you in the next one.